Welcome to WKRP Montrose, a radio station masquerading as a podcast about Montrose, Colorado and the Western Slope, recording live from the Clear Network studio in downtown Montrose, Colorado. All right, everybody, welcome to another episode of WKRP. There's a little bit of a delay there. That's making me nervous. I don't like delays. Why is there a delay?
Okay, fix it then.
Well,
is it recording?
It's recording. It's good. Yeah. Well, you know why there's a delay on the hardware, but you know what? There's not a delay on. There's not a delay on you downloading this episode because Clear Networks is the fastest internet on the Western
side
Slope.
of the Mississippi.
This side of the Mississippi. We'll go with that.
And I won't put money on that, but
Maybe you should.
Clear Networks will stake their reputation, I'm going to say, on them being the fastest internet west of the Mississippi.
We're making a lot of claims for them. I mean, is it better that we just leave that the way it is and we don't clarify what makes it the fastest?
I mean, I have no
clue.
Authority to talk on behalf of Clear Networks.
All right, we have a new libation sponsor this morning.
No, we don't.
Yeah,
because we have to pay for these.
Yeah, just
FYI, Clay.
Yeah,
you know what? If you want to be our coffee sponsor when we have these episodes in the morning, then we're open to that. But coffee sponsor means we don't pay for lattes anymore.
Is that why you're purposely not holding the cup where the logo can be seen?
No, but look.
There you go,
Clay.
Yeah,
this one's a freebie.
Okay. You didn't even turn the logo all the way around.
But just remember, Clay, and everybody else out there, we are not a non-profit.
That's correct.
We just happen to have no money.
Not one and the same.
No, we don't want to be a non-profit.
Right.
So if anyone out there wants to help us cross that bridge to profitable.
Okay, enough of trying to pay the bills.
Yeah, exactly.
Listen, here's the thing.
I will say this is good, though.
It's very good.
The foam is lasting, which is a pet peeve of mine when they don't.
All right. So normally these episodes, as you guys know, is WKRP, We Know Real People. The idea is to get to know the person. And we definitely want to get to know this person. But what he's doing in Montrose.
This is good. You're setting yourself up. You're not going to explain that you didn't take the time to research our guest.
Right.
You're kind of like sugarcoating that by pretending that we're going to talk more about the business than the individual.
I mean, thanks for outing me on the episode, but
why wouldn't I do that?
I mean, it sounds like something you would do.
Right, exactly.
Do your friends know that you treat people this way? Or do you treat your friends this way?
Yes, of course.
Oh, okay. All right. Well, I guess I shouldn't be surprised by that at all. All right. So our guest today is Andrew Beard. Andrew, thank you for joining us.
Thanks
I'm assuming looking at the beard, I'm assuming I announced the last name correctly, right?
Yeah, it's not Andrew Mustache. It's Andrew
Beard.
Yeah.
Nice.
You can call me Drew.
Nice recovery.
Drew. Okay. Hey, quick interesting fact. So the three members of ZZ Top, right? The one guy without a beard.
His last name is Beard.
His name is Beard.
It is. I've only heard that about 4 million times.
I bet you have.
Thanks for letting everybody else know.
Do you know him? You related to him? No.
Yeah, are you related to Mr. Beard?
I wouldn't be opening up a new clinic if I was.
Yeah, you'd be living off the royalties of ZZ Top?
Yeah,
it didn't go that way.
This is Uncle Frank's money. All right. So where do we start? Well, first,
Andrew, do me a favor before. We might have to pull that up a little higher. You know what? I'll come and do that real quick. All right. You go.
Okay. So we do get complaints. In fact, we had one yesterday about the sound quality, and I forget where the complaint came, but somebody said, I've listened since the beginning. I really like what you guys do, but it's hard for me to listen sometimes because the sound quality is so poor. I mean, that's on Dennis for a start. But yeah, somebody did actually. It's constructive criticism.
And Savannah, I know who you are, and get a better Mac or a better computer with a better sound system.
No, it was one of those Montrose message board type people.
Sure it was.
No, okay. And I appreciate the fact that they said they listen and they do like it, but I understand if it's hard to listen to. One of the complaints was sometimes the guests, especially, are not close enough to the microphone. Which, I mean, I'm hoping you just solved.
Yeah,
so.
we just fixed that.
Yeah,
can we hear you?
Yeah, I think we can.
Yeah, there we go.
All right.
You sound good. All right.
So I'll start because here's the thing. I have a touch of, I don't know what the right word is, but if somebody in town, I'm like, oh, Andrew is opening this new business and yada, yada, yada. My assumption is that Andrew may well be new to town, because if I don't know you, I'm assuming you're not around.
Okay.
Right? Which is not fair, because, I mean, we have a lot of people. Turns out that Andrew's not new to town at all, according to his website. He's been here 6 years.
Longer than that. I've been here for almost 11 now. I mean, we moved out here in 2015 from San Diego.
Okay.
Yeah.
So you've been here long enough? Like you went through
you've been here longer than I have.
You went through COVID with us.
We did.
Here,
yeah, that was a great
which
time.
was a different experience.
Yeah.
Here than it was in other places, for sure. Definitely different than California.
It was something way different. I was very happy to be here as opposed to San Diego when COVID hit.
Yeah.
So that being said, your business is Montrose Direct Primary Care.
Right.
But that's just starting. So what did you do before this? And we'll get into.
He practiced internal medicine in Montrose.
That's right. Yeah, for Cedar Point. I've been working for Cedar Point for like nearly about 6 years. I just ended my relationship with them here recently.
Okay.
Yeah.
Hey, Rob, don't act like you I know you.
You didn't do your job.
I can see the smirk on your face. Like you're so happy.
I'm just going to read out his bio from his own website.
Yeah, you're just going to go right down.
Which is what you could have done. But okay.
Well, while you're at it, keep going.
Let's go back 11 years ago.
Sure.
What made you leave California, San Diego, to come to Montrose, Colorado?
Yeah, so I was working emergency medicine in San Diego at UCSD, doing level 1 trauma there. It was really interesting, fascinating way to practice medicine. But my family and I just were not making it work there. I was making good money, but we were sharing walls with neighbors, listening to them all night. It wasn't working. And I was desperately just holding on to my surfboard, trying to make it happen. Wouldn't happen.
Right.
And so, with the help of family, friends, we moved out to Montrose in 2015. I've actually been coming out here since I was a kid. I've had grandparents out in Ridgeway since the early 90s. And so I'm familiar with the area. My parents moved out here in 2008 with my sisters. And so they were all kind of out here, and I was the last one that was holding on. And so they brought me out, and we moved out here then. And it's been great ever since.
All right. So did you bring the surfing passion with you to Montrose? Do you do a little bit of the river surfing?
I've tried it. It is very different than ocean surfing.
It's the opposite, right? The water's come in the wrong direction.
It is. I could not wrap my head around it at all. So whenever I go to the ocean, I still surf. I've tried river surfing here. It's not working, man.
You don't feel it?
No, I mean, I'd love to feel it.
Right.
I just couldn't wrap my head around it. So I think I need some more practice.
All right.
You got tired of feeling the face plants into the water. Yeah. Like that's the thing. I've told Hollis a number of times, I think that there should be a weight limit to be able to go out and do that. And I feel like I exceed the weight limit to be able to go
Well, there's no limit, under the terms of the law, but there's a physics suggestion.
There's a physics problem there.
But you just get a bigger board. We'll get you one of those we'll get you a novelty one that's like 4 feet wide.
That's probably what we
12
need.
12 feet long, so you can stay on it.
And then tether it to either side of
with
the...
an engine would probably also work as well.
A boat with an engine.
Yeah, I think that would also help.
Thanks for piling on.
Yeah. We have a lot of river surfers in town. Who did we have on the other day that river surfs? One of our most recent guests also.
Are you talking about Greg Cairns?
Greg does it.
Yeah.
You got to...
We didn't get to talk to him about it, but he's like, it's a big thing around here.
It's huge. I mean, we're lucky to have the park for sure. So.
And then we have the big event. So, anyway, we're getting off topic. Direct primary care. This is something that I think, first of all, it sounds like the word itself sounds ridiculously simple and obvious.
Yeah.
Like I want direct primary care.
Yes.
But the standard person who has insurance, do they have direct primary care? What is the biggest difference between what people know is having insurance and getting healthcare and this type of service that you're offering? Right.
And that's the biggest question I get about it since starting this is, what do I do with my insurance? I have this insurance. I pay for it. Like, how does this interact with you? So what direct primary care is a model that requires a monthly membership, and that's a cash agreement between you and the medical provider. For my model, almost everything that happens in the clinic is covered under that membership model. Same day visits, next day visits, 60-minute appointments, direct access to me through messaging. And then anything that we do inside the clinic is covered. So for example, you come in for your annual, we do some blood work, that's covered under your membership. You come in 3 days later with a UTI, I test your urine, I hand you antibiotics, you walk out, that's covered under your membership. Right. You can still use your insurance when you leave the clinic. So for example, if I order an MRI for you, you go to the hospital and you'd hand them your insurance card and they would do your MRI. So you can use your insurance, but just between you and me, the agreement is for cash and it covers pretty much everything.
Now, you're not the only direct primary care in town.
No, I'm standing on the shoulders of giants here. There are a few others that have really pioneered the model for Montrose and done quite well.
And why do you think that, why is it that people are choosing this model over their traditional insurance or traditional provider method right now?
Great. I think that healthcare is in a bit of a flux right now where patients are getting a little fed up with the care that they're receiving and providers are getting fed up with delivering that care. I think the whole system is pretty broken. And so, you have patients that are waiting weeks or months to see their medical provider. Mm-hmm. And then when they get in to see him, it's maybe 7, 10, 15 minutes, right, if that. Mm-hmm. And then you rush out of there and then you pay your copay and you go. And then you have to wait weeks or months to see him again. And then similarly, as a medical provider, that's not why I went to school for so dang long, was, right, to rush people through and just be another cog in this massive corporate machine. And so it's equally as miserable for us as well. And so that's, I think, the entire draw for me into this model is to deliver care the way that I think it should be delivered, but then also to give it to patients in the way that they deserve it. And honoring their medical needs, their emotional needs, their spiritual needs, and creating a space and time to engage with that. Is
the fact that the healthcare providers do rush patients through, is that a result of the system too? Are you told, hey, you got to make your numbers, you got to metrics, or
Oh yeah, absolutely. So your medical providers are paid by something called relative value units, or RVUs, and what that is it's complexity and time in this calculation that then gives you a number, and then based off of that number, Medicare gives a certain amount of dollars for that. Right. And then you get to keep a certain amount of that, whatever the company has set up for you or whatever corporation that has set up for you. And so you're incentivized to move people through quickly. Right. And that's not the way that medicine is supposed to be practiced, in my opinion.
Yeah. So it's a horrible system.
Does this direct primary care and a membership method bring us back to the days of like the community doctor or the hometown doctor? Like, how are you going to be able to change that methodology through this type of business model?
That's a great question.
Is it like limited membership? Like
it is. That's exactly right. So over at Cedar Point, I actually have one of the largest panels at Montrose. I was taking care of around 1,700 patients. And here I'm capping at 500, but really I'm probably going to reevaluate at 300 and just say, okay, hey, what's going on? Does this feel good? Does this feel right? And so with that smaller panel, that's what allows for all those promises I just made, that same day, next day appointment, 60-minute appointments. If you text me or if you call, I'm the guy that's responding to you. And, the home visit part of that too, you asked for like the old time hometown, provider. Yeah, man, like that's absolutely included in that. And so if you're not feeling well, if you're laid up, you can't come to me, I'll come to you. And we'll evaluate you there and see how we can help. Telemedicine is always an option within that too. Yeah. So there's just a bunch of different modalities if you're not local to Montrose where you can get quick access to care.
You know what it reminds me of? Have you seen that movie Doc Hollywood?
Yeah, with Michael J. Fox,
but not Michael J. Fox. It's
the old man
at the start of the movie. Yeah, it's the old doctor, and he knows his patients so well. Yeah. One of them has a case of something, and Michael J. Fox is trying to diagnose him, and he goes, "Just give him a Coke," and it's like indigestion or something. But it sounds, honestly, given the way that healthcare operates here, what you're proposing and what direct primary care offers, it actually sounds too good to be true. You will come to somebody's house, or they can make a call and come in the same day. Obviously, healthcare in this country is very different to other countries, but why does it sound too good to be true? Is it because we've just been conditioned for so long by insurance companies and the way that it works at the moment, or it doesn't work, actually?
The system is set up to not honor patients or medical providers. It's set up to honor corporations.
Right.
And so we're all feeding into this machine, in my opinion. And so that's why it feels strange. Like, wait a second, for this small nominal fee, you get almost concierge style access to a medical provider. like, how is this even possible?
Right.
It is. It maths out. I mean, and so at 300 patients, I will actually make more than I was working at Cedar Point, and hopefully work a little bit less.
Right.
And then be able to really provide that intimate care that patients deserve.
Yeah. When it comes to, you said you can provide things like antibiotics and
Sure.
I assume medicine is not included in the fee, the monthly fee, but do you get discounts and things like that?
Yeah, absolutely. So through direct primary care models, you have access to tier 1 pricing for cash for certain things. So for example, if you wanted an annual panel and you were in a patient of mine, it would cost you like $20. You go through your insurance, sometimes it can cost hundreds or even thousands of dollars to do that.
Right.
But we have access to these tier 1 cost tiers rather. And so it really does not cost a lot of money. And the same thing for medications too. I'm going to have a very limited pharmacy in there just for like acute sick needs. And I'm just going to include that in your membership.
Okay.
So if you come in, if you're sick, you need something, I'm just going to hand you antibiotics, or I'm going to hand you steroids.
Yeah.
And you're going to walk out of there and be able to go home and recuperate instead of wait an hour or two at the pharmacy for it.
So you,
just to be clear, not like steroids.
well,
But
no,
you know,
You can
like,
talk. No, I'm sorry.
but is it kind of like a collective bargaining type situation? Where, are you part of a direct primary care like organization with dozens, if not hundreds, of you guys bargaining for those prices?
That's right. Yeah, it's called a group purchasing organization or GPO. And so, yeah, I'm a registered member of that, and then I get access to all of that.
all right, so I'm going to re-ask his question in a little bit different way.
Okay.
What's the catch?
Yeah.
Like what? Yeah. So if it sounds too good to be true, right?
Yeah.
There's always some sort of catch. What's the catch? What would be the thing that you would be like, I want to make sure that I don't set the expectation that people think that they can get this?
Yeah, I mean,
Because people don't understand. Like for example, and I'll back up a second.
Sure.
Your actual title or medical title is a nurse practitioner. Correct. How is that different from what somebody would think as their doctor that they go and visit at a care facility? Or even for a lot of us, maybe that don't have insurance and we go to an emergency care facility, how is that different?
So a nurse practitioner can practice independently in Colorado. Colorado is one of 35 states that allows for that. So it's actually, in the majority for that. And when you come and see me, it feels no different than when you're seeing your physician. Honestly, I'm ordering independently. I'm diagnosing independently. Everything I'm doing is just between me and you. And so it's not going to feel any different. The difference between a nurse practitioner and a physician is honestly just a little bit of extra education and a focused residency. So a nurse practitioner is more of a generalist. And then after they graduate, they can specialize into certain things. Like, for example, I've specialized in obesity medicine and I've got extra education in that.
Why did you look at me when you said that?
I looked right past you, man. I was actually looking at the wall. It was a soft case, very soft case.
No comment. No comment.
Anyway,
It's the sweater. It's not okay.
Yeah.
Yeah. Right.
Okay. So it's more general.
It is more general, but then you can specialize. But then, as a physician, you would do your residency in emergency medicine, like what you mentioned. And then you have a whole scope of practice within that. And so your nurse practitioners are certainly limited. You're not doing surgery. Right.
Yeah.
You're not doing incredibly invasive procedures. You're not opening up someone's skull and operating on their brain.
Right.
But from a general perspective, we do pretty much everything that a physician does.
So and I want to, again, to kind of follow on from what Dennis said, to make it a little more clear, this doesn't replace insurance.
Correct.
Right. In some respects, like if you break a leg, you need insurance. If you break a leg, don't call you.
Yeah.
Because
you can call me, but I'm going to tell you where to go.
Right. So I guess then the way that I'm understanding this is if you called your insurance company and said, hey, I'm going to go down this direct primary care model, how can I change my insurance so that I don't have to pay for certain things, but I can retain other things? I can retain emergency care, or I can retain treatment for more serious conditions. Is that the combination? Is that how this works?
Yeah. So a lot of patients who engage in direct primary care either have like a bronze tier plan or a high deductible or a catastrophic plan.
Right.
And that way, if you get in the car accident, if you break your leg, as you mentioned, you have that coverage where you can go to the emergency department and not go broke after that.
Right.
But the real benefit is that under the monthly membership fee, there's no hidden costs that are associated with that. So for $125 a month per individual for me, or $225 per couple, when you come and see me, most everything is going to be covered in that.
Right.
So I thought I had an idea. I thought we could play a little game.
Oh, okay.
I just looked up the most common reasons for a doctor visit. And so I thought I'd run down these and you tell me, can I get that care
Send it
with you?
Let's do it.
Are you ready?
Yeah.
Okay.
We should have jingles for these kinds of things. Plan this in advance.
Well, yeah, what do you want me to have, like a game show?
Yes.
Like, here, let me see. Well, let me see if I can
Presented
find
by
something.
the Wraithbone.
Yeah.
Don't press too many buttons. I don't want you to delete the recording or anything.
No, I'm not going to delete the recording. I mean, we've got the, this could be a good one. Although we have to pay, do we have to pay royalties when I do this?
I hope not, because if we do, we are
Well, I didn't
broke.
finish
Both
it,
of us
right?
are
I
broke
didn't
Over for
already.
the Price is Right jingle, but
that would have been a good idea.
That'll work.
We, we've got an intern. I should probably see if he can help me out with that.
All right, stop pressing buttons. Let's play the game.
All right. Hold on a second. Okay, here we go. So, upper respiratory tract infections.
Come on in.
Okay, hypertension.
Yep.
Arthritis.
Yes.
Diabetes.
Yes.
Depression and anxiety.
Yes.
Pneumonia.
Yes.
Headache, fatigue,
Yes. Yes.
skin conditions,
Yes.
back pain.
Yes.
Are these all things you have?
Yeah, I was just reading off. I was just reading.
down the street. We can get you down there.
I was reading off my recent billing statements. Okay, how about injuries? So sprains,
Yes.
like cuts, severe cuts.
Yeah,
Can you do?
absolutely. So I do laceration repair and all of that too as well. So if you come in and you're out working in the field, you cut yourself, I'll stitch you up.
Right.
Okay. X-rays.
I will send you for x-rays. I don't have an x-ray machine.
Okay.
But do X-rays come under sorry, what was the term you used for like the collective bargaining?
Membership. Oh, I mean the GPO.
Right. So, okay. So X-rays will be charged at the rate, whatever the hospital charges for those.
That's right. And I'm actually working with the hospital and other community resources to develop cash pricing for those things.
Okay.
So if a patient does not want to engage with their insurance, then we're going to have cash prices for all that as well.
Okay. And if people want to find out, they have questions for you, like, hey, what is and isn't covered.
Yep.
They can just call, they can email, they can come in and see you.
Absolutely. Yeah. The clinic opens February 2nd. So I'm not going to be there until that point.
Okay.
We are having an open house on the 31st from 2 to 4.
Okay.
And so you can always just stop by too and just come talk to me, do a little meet and greet and ask your question.
The clinic is right across the street from our studio. It's on Cascade.
Right. 16 South Cascade.
16 South Cascade, right kind of a couple of doors down from Miss So, the new restaurant, opposite the Rathbone, opposite the theater. So February 2nd is open.
Yeah.
And the open house is the 31st.
Correct. You got it.
And can you sign up for membership then? How many memberships are available right now?
We have 200 left. We are filling up pretty dang quick. It's really great to see.
One of the things that people run into with just typical healthcare right now is, do you have a provider that's in your network that is taking patients?
Right.
So, just the fact that there's an opportunity to be able to do that, I think is something that I would imagine you would fill up really fast. This community is growing really fast as well, too. As Rob pointed out recently, he wants to see the growth slow down and sustain. He doesn't like all the people that are coming into town.
Managed. Is the term.
I don't think that's how you said it. I think you were kind of like, I'm tired of all these foreigners coming into town. All these non-Coloradians.
Yeah, that's not a hot button topic right now.
I've been here long enough. I'm a local by this point. We might edit that out.
No, we're not editing that out. Listen, I'm here to tell you guys how it happens off screen, and that's how it happens off screen. Some of us want to shut the door to others, and other people want more people. The more the merrier. I'm a more the merrier type of guy. Okay, so we've gone down all the basic reasons somebody would come in to see the doc, basically.
Right.
And we can handle all this. What is something that you can't do that maybe somebody wouldn't understand? Like, what's something that you try to make sure that you pay attention to? Somebody that's coming for direct primary care membership for the first time, it's like, hey, like you just mentioned UTIs. I guess I wouldn't have even thought. I was like, okay, I wouldn't have thought that you could then hand them antibiotics and send them home.
Right.
What is something else maybe that I wouldn't be thinking of, or that I would assume that you could do and maybe you can't?
One thing I'm not doing is obstetric or gynecologic care. I just don't have the resources for that. So if you're one of those patients, I can still take you for primary care, but if you need that type of care, I'm going to refer you to a specialist for that, or one of my partners.
Right.
So like if I'm premenopausal or I have
I
issues
can handle your hormones for sure.
Oh, really?
Yeah.
Okay.
Oh, absolutely. But as far as like, hey, you're pregnant, you need pregnancy care. You need a pap smear. I'm just not set up for that. Right. I'm going to send you to a specialist for that.
Okay. That was, again, things that you don't know. You don't know. If you don't ask, you don't know. That type of thing. So,
so I'm going to read a little paragraph here, or some of it, and I want to go back a little bit to your, I guess, training, where that started. So, so you were in the Marine Corps.
I was.
Yeah. You want to tell us a little bit about that? Because it says this is where you began your medical career in some fashion.
Yeah, in a way. And that's where I really got interested in it. So I joined the Marine Corps at a high school. I went into the infantry, and watching the corpsmen work was very interesting to me. And I thought, okay, hey, there's something here. This is pretty neat. And so when I got out, I went to EMT school, and I was an EMT skills instructor for a while. And then I joined UCSD to become a trauma technician. And that's where I spent a lot of time doing level 1 trauma as a trauma technician. I initially wanted to be a paramedic. I missed the camaraderie of the Marine Corps. I thought I wanted to be a firefighter, paramedic. Right. And then I found out how much those guys made in San Diego. I'm like, okay. Right. Yeah. So I went to nursing school instead. And then I continued my career in emergency medicine there. And then I moved out to Montrose, worked in the ER here for a little while. Okay. My kids were pretty young at that time. And when you have kids, things change, perspectives change. And, you know, I used to be able to handle pediatric traumas, pediatric deaths. Okay. Right. And then when my kids were little and I saw that, I just knew it was time to go. Yeah. And so I moved into case management at that point for the hospital. And I did that for a number of years. And that was the real inflection point for me. Do I want to go be an administrator? Do I want to stay on the clinical side? And I knew I wanted to stay on the clinical side. Right. So that's when I went to nurse practitioner school. Took about 3 years. And then I graduated, and then COVID hit. Right when I graduated, actually. And so I actually served on as a temporary medical staff at the hospital during COVID. And then I started at Cedar Point about 6 months later. So you went to nurse practitioner school. Do you have any desire to get to become an MD? No. What would the path be? Just out of curiosity. I would have to go back to medical school and do all 4 years of medical school, and then residency, and then come out. Right. And there's not a huge, for what you're offering in Montrose, you don't need that. No. For what you want to offer. No, I don't think so. You know, I mean, my physician friends and partners, they deliver amazing care, and they're a great resource for me just because they have different training than I do. And so I certainly lean on them for a lot of different things. Yeah. And I call them for advice and for questions and all of that, but I feel no need to torture myself again. And it's not cheap either, right? Oh, no. No.
Well, I think back to the generalization of the industry, like I think that a lot of people are concerned, like, especially if you think about, let's just say you mentioned you have kids. My kid's now grown. She's 20. No, I didn't say you're grown. You're just grown.
She's 20.
Yeah.
Yeah.
Mm-hmm. You know, her trying to figure out her healthcare now moving forward. Yeah. And trying to like help her figure out like what's necessary, what she needs, you know, for a period of time during my wife and I's life, we always had insurance for our daughter, but we didn't always have insurance for us. Sure. And in part, that felt like our responsibility to make sure that we were like eating right, you know, taking care of ourselves, making sure that we, you know, either took certain vitamins or made up, you know, what we weren't getting in our diet type of thing. Yeah. And that worked out for us. You know, we were gambling on the catastrophic side of things, right? But we felt like, you know, from the day to day, year to year type of thing, it felt safe, I guess, to do that. But a lot of our friends and everybody just thought we were crazy. And as I'm reading this list of like the things that people normally go to a doctor for, a lot of those didn't apply to us. So what do you think you hope to have 300 to 500 clients. Mm-hmm. What do you feel like your yearly type of responsibility to them is going to look like for that? Is it just some people get chronic illness and because they don't take care of themselves or whatnot? But do you get where I'm going with this? It's like, I think sometimes a lot of us get scared into coverage that we don't need is what I'm trying to say. That's where I was trying to go with it. And, you know, because of all these things that you see out there and everything that could go wrong. And is that really the truth? Or is it if you have somebody like, if you have access to direct primary care, you have somebody that you can call, kind of, you know, don't do the Google your symptoms on, you know, online. You find out that you don't need a lot of that. I've often had physician advice that, like, I could give you a steroid or I could give you a antibiotic, but that's your choice. Do you want to do that? And for me, a lot of the time was, well, if I don't absolutely need it and you don't think this is going to get worse, no, I don't want it.
Yeah. So to answer your question, I think that prevention is the best medicine. And so, you know, the way that I think about health is when you have a problem, it's kind of like a pinhole leak in a pipe in your wall, right? It could be a very small problem. It's not a problem in the moment. You may not even know it's a problem, but 5 years from now, when that wall caves in, you're going to see exactly how big the problem is. And so the ability to be able to just text me and say, hey man, I got this going on. You think this is anything? I think is worth a lot.
Right.
And then
I think it's 90%. I guess where I'm getting at is I feel like that's 90% of it.
It can
really
be.
Just having the idea of like, hey, you know more than I do. You studied this,
right?
You see it. Practice, you know, being around it more often is an important part of it as well.
For sure.
But I think that, you know, I don't know. I'm coming back to this idea. It sounds so, when I started the episode, I said, it sounds so obvious, right? Why isn't this the primary method for everybody?
I think it's going to be. I really do. So in the big, beautiful bill that just recently passed, just recently allowed for HSA and FSA funds to be used for direct primary care memberships. This is brand new. So I do see a movement towards this sort of model. And I see patients rejecting insurance right now. You've got all the subsidies that just expired for the ACA, and patients are paying a lot of money for insurance that is frankly terrible.
Can you just, before we move on, explain what the HSA and FA
health savings account?
Okay.
Yeah.
And a flexible savings account. Yeah. And so, you know, these are offered either through your insurance or through your employer.
Right.
And they are special accounts that you can put money in tax-free.
Right.
Pre-tax. And then you can use it for qualified health expenses. Okay. And that also is not taxed.
Right. Now, primary, you are also qualified
for the membership specifically,
right, to use that money,
which is huge, and because it didn't used to be that way,
right.
And so now this is a really nice, like, triple tax advantage way for you to come see your medical provider.
Right. Can I so are you at all concerned about you guys in general becoming almost like public enemy number one for the insurance companies? Because you are, as this model becomes increasingly popular, you're going to be hitting their bottom line. Mm-hmm. I mean, they're very powerful, you know, the lobbyists and all that kind of stuff. Are you at all concerned, or do you have any thoughts about how they may try to lobby the government, lobby politicians to change things so that it's not an option? It makes life more difficult for you guys.
We would dive really deep into this. The idea is that the middleman in between the provider and the patient is the issue.
Oh, 100%.
It's where the costs go out of control.
And you've just gotten rid of the middleman. But the middleman happens to be quite powerful in this country.
Well, they happen to be quite wealthy.
Yeah.
And so.
Yeah, well said. So, you know, I like I said, I see the tide going the other way. And I see more of, hey, how can the individual become healthier? Is it possible that these humongous corporations and interests can get involved and say, hey, we're stopping this? I suppose so, but I don't know. I think that being an American is very unique in that when you have a problem and there is no solution, you can create the solution for yourself. And that's essentially what we've done here, right? Like, we just created a brand new model, and we're delivering healthcare to a patient in a way that I think needs to be delivered. Right. And we're taking away any obstacle to the patient to be healthier. So yeah, no, I think that Americans are uniquely positioned for this sort of thing. And I could see maybe in other countries how this would be met with a lot of resistance, possibly.
Right.
But
yeah.
Here, maybe even on the Western slope too, where there's even more rugged individualism here, I really see this type of model thriving.
So you kind of have faith. You have faith in.
Oh, brother, I got faith in a lot of things.
In the American dream and that kind of stuff. That
I'm living it right now.
This is the right way, and that you have faith that this is going to kind of prevail, essentially.
I really do. I mean, you can see it in legislation. You can see it in attitudes from patients. You can see that the system is failing. Medical providers are fed up with the system as well. I cannot tell you how frustrating it is for me when I want to do something for a patient and I've got some insurance person on their line telling me no.
Right.
It's like, what do you know?
Yeah. Did they tell you? Yeah. I guess you've had that experience where they're saying, well, we don't think that's necessary. And you go, well, actually, I'm the one who's qualified to say.
I'm getting fired up right now talking about it. It frustrates me to know it.
I think the good news.
He just bowed up on you. Like you were the problem.
You weren't intimidated though, so I need to do some work.
The good news for the model though is that it's not just the patients that want this. It's the medical providers too. And so you have everyone who can make this happen. Like the insurance companies are the only ones who are really not going to enjoy this. But if the medical providers and the patients want it, it seems like it's just going to be very difficult for the insurance companies to scupper this whole thing.
Right. You may not be willing to answer this question, but I'm going to ask it, and you can decline. Do you think, based on that, do you think that more of your colleagues from other organizations in town would consider this as an option?
I know they're considering it as an option.
Okay. All right. I could see that being the case.
Yeah.
Like, I mean, I know other people that you worked with in that facility, and I just know that to Rob's point, I think people misunderstand that it's not your physician that wants to necessarily provide the service the way they're providing it. They're required to.
Thank you.
Based on the setup or the agreement or whatever they have with the organization that they're operating through.
Yeah. Well, I guess to follow on though, the question is, why wouldn't somebody want to transition to this model? Mm-hmm. Are they stuck in the system? Is it too much hassle? Why would a doctor or a medical provider not want to go into direct primary care?
It's risky. It's very risky. You're leaving a set system that, the entire country is set up for, and you're going to rebel against that and say, no, I want to deliver care my way. And so in order to bill Medicare, for example, in order to treat Medicare patients, you have to opt out of billing Medicare for 2 years in order to deliver this kind of model. So this is a 2-year gamble for me.
Right.
So it's a big old step out. Mm-hmm. And so I think that medical providers may be scared of that. And not to mention, running your own business is not the easiest thing on the planet. And so, I am now the medical assistant, the office supply manager, the security guard, you name it, right? And it's just not me showing up and delivering care every day. I got to do a lot of other things too.
I guess too, as well, that in your field, you probably need pretty good liability insurance, right, and other factors that perhaps other business owners don't necessarily have to have.
It's not cheap either.
Yeah.
It's definitely, not to misassign this word, but it feels very entrepreneurial. Like, it is. Not everybody's meant to go out and own their own business. Not everybody's meant to go out and do their own thing, so to speak. So, and people don't understand, like, when you start something new, you wear all the hats.
Yeah.
So that would, to answer that question, I see that all the time, not just in the medical
Do I look tired to you? Yeah. I mean, yeah, for sure, man. It's a lot.
Yeah. I one of the question about patients now, if you are inevitably going to have, let's hope it's just one patient, but somebody who leans on you a little much.
Yeah.
You get a phone call every day.
Sure.
I got a sniffle. I got this and that. How do you deal with that person, on a human level, but at the same time say, hey, I'm here to help you.
Right.
But I'm not your personal physician. So how do you balance that up between people who may lean on you a little bit?
You get a hypochondriac. You got.
Are you feeling out for yourself, or what's going on here?
No, he's asking for a friend.
It's him I'm thinking about.
I think just the way that you navigate any relationship, you set boundaries.
Right.
I mean, this is no different than a friend or anyone else like that leans on you in an inappropriate way. You need to set that boundary, and if they don't respect the boundary, you end the relationship.
Right.
And there are certainly mechanisms in place for me to protect myself in that. Right. But, I think that patients, if they're paying into this model, they deserve a little bit more than calling and getting a robot or calling and getting passed around to different voicemails and then never getting a call back. Yeah. And so, no, I do plan on delivering that personalized care, but there certainly are boundaries.
I guess extremes either way are not good in life in general. I mean, I guess if you run a restaurant and you have a customer that keeps coming in and abusing the staff, you ask them to leave and not come back.
Right.
So I feel like we overlooked a really important part of this conversation. How much is the membership?
So it's $125 per month per individual, or $225 per couple. If you pay for the year in advance, you get a month for free.
Okay. There you go.
What does that come out? What does that come out to?
You make me do math in front of everybody right now.
225 for a couple is
$13.75 and $24.50.
There you go. All right.
So
that's it. You did
so
it.
Here's the thing, guys. Let me make the math a little better for you. Probably less than your deductible that you have to pay for the entire year.
Thank you.
Is this membership, and you get to know that you have somebody that you can call, somebody that you can go and see, that can handle 70, 80%, well, 100% of the list that I just went down of the things that you're likely going to run into day to day.
Well said. Yeah. I mean, through my W-2 job, I mean, my family's deductible is like $15,000 for the year.
Yeah. It's crazy.
Yeah, it's
Things
crazy.
are getting out of control for sure.
I'll give you a hypothetical. What if somebody was on a rope swing and I
have a feeling this isn't hypothetical.
This is not a hypothetical at all.
They dismounted the rope swing not particularly gracefully, and they broke, let's say, 3 fingers. 1, 2, 3. Yeah. Could that person come to you, and what would you be able to do and not be able to do? Let's just assume that one of the fingers, this one, was dislocated. The other 2 were broken. How much would you be able to cover and do versus not?
Is there a video of this incident?
There should have been.
No, there's not.
Yeah.
That's too bad. So no, you could come in. I could certainly take a look at you and then say, hey, we need to get some x-rays on this. Okay. And then we will confirm that dislocation or that fracture. And then I'm going to send you over to Tim Judkins, who's our orthopedic hand specialist. He's the man.
Right.
And he's going to get you fixed up. But I could certainly splint you in the meantime and get you over to the specialist.
Not me. Again, this is hypothetical.
Yeah.
I'm assuming you'd be able to just do that and relocate my finger. Is that the term?
I give you a shot of whiskey, give you a belt to bite down on, and then we just get to work.
Back in the old days.
Yeah, exactly. Here we are.
They do look a little jacked up still.
Oh, they are.
You've got the Jimmy Fallon look.
That one will forever be like that.
Yeah. So we knew it was.
Luckily, there was no alcohol involved.
Allegedly. Allegedly.
We'll cut that bit out for sure. Yeah, it's a really interesting model, and I'm glad that you are doing it in town, and we have a few other people, and I think it's going to become a really popular thing for people.
I don't think you're going to have any problem filling your membership.
Yeah.
I do think
so far so good.
I love the idea that your first response was, I'll wait till we get to 300 and then I'll reevaluate.
Yeah,
like wanting to be able to. There's something that connects with me directly. In the limited healthcare that I've had, the biggest issue that I've had is physicians, probably because of the thing that you talked about, like their schedule is kind of set for them. They're incentivized by how many people they have to get through.
Right.
I'm somebody that I have questions. Yeah. And I want to be able to trust somebody to want me to ask those questions.
Right. Mm-hmm. And you don't want to be fobbed off, right? You want somebody to take their time and explain things to you instead of, and again, it's interesting to know that there are ways and methods that doctors have to get through the numbers. They have to get through patients. So it's maybe not that they're impatient with you, but it's like, I don't necessarily have the time to sit down and fully explain this to you, because they don't have that time. You do, and you will.
Hopefully you will.
Oh, absolutely. No, it's very important for me to deliver on these promises. I mean, and I got into this not only just for patients, but for me. And to make this sustainable for me for a career. Yeah. And so, when you come into my office, it's going to feel like coming home. Honestly, it looks like a living room. In there, we have an exam room, we've got a procedure room and all that. But there's like a couch and there's a fireplace and like nice swivel chairs. You're going to have a cup of coffee or tea, and we're going to sit down for an hour and we're going to talk about your health in a way that is unhurried, unrushed, and we can really explore the nuance of health that you don't get in the corporate office, that you don't have the time or space to really explore.
That's what I want. I want a health therapist. That's what I want. I want somebody that sits down and goes, okay, let's talk about what you've been doing.
We don't have time for that.
What's right? What's wrong?
Stop making up terms. You're not allowed to make up terms.
I can do whatever.
This is the United States.
I can do whatever I want.
You don't want him as a patient. I can promise you that, because he's going to come in there, have a cup of coffee, and just want to talk about his day.
Hey, man. That doesn't sound like a bad way for me to
Inconceivable. Inconceivable.
You're gonna get us in trouble.
All right. No, in all seriousness, thank you so much for coming in and helping us really kind of break this down. Again, mention the open house date again one more time.
So it's on January 31st, 2 to 4, 16 South Cascade. Come by, see the space, ask some questions. I'd love to see you there.
Okay.
We'll put the link to your website in the description of the YouTube
Look
video.
Look at it down below.
Yeah.
All right. Before we let you go, normally we ask somebody to choose somebody else to come be in the seat and share with us. So I'll give you a second to think about that. And then as a health professional, where would you recommend people eat in Montrose?
Oh, man.
No, not as a health professional.
I know. Can I take that hat off for a second?
As someone who just eats food.
Thank you. Yeah, I eat food sometimes.
Yeah. No. You got to do both. You got to do both.
Don't have to do both.
Yeah, you got to do both.
Okay.
He eats burgers too.
Yeah, the non-professional answer is, because I'm right next door to him, is Colorado Boy. I love that sweet calabrese pizza that they have. Oh my God.
So good.
It is so good.
Yeah.
Yeah. And then I guess the healthy answer, Urban Hippie. It's pretty nice.
Okay.
Yeah. But I'm always a fan of patients making food at home.
There you go.
You know, I think that's really the ticket for nutrition and good health. Don't eat out as often as people do.
Yeah.
And then
I hate that answer.
Well, there's a reason that restaurant food tastes so good.
It does
And
taste
it's
good.
because they don't shy away from using butter and cheese and all of that good stuff.
And you don't have to do the dishes.
No,
But
that's
it's not,
the big part.
But it's not. You can't eat a calabrese pizza every day. That's
true too.
That's not good for you.
I went to Eatery 66 North last night. It was pretty good.
Yeah. I haven't been to the new one yet. I've been to the one in Ridgeway.
Yeah, this one's really good. It's it's the second place that I've gone to that I walked in and forgot that I was in Montrose. Like,
Which I'm hoping we get over that. I'm hoping
it's coming. Well, it's definitely coming. It's on the way.
I don't love the idea that you're trying to forget you're here.
No, that's not what I meant by it. But it's something that Montrose is not. It's not something that they've seen before.
No,
unless they're well traveled.
But hopefully, a couple more restaurants, and it will become the norm here.
I would love that.
Great places.
By the way, get prepared to have a hard time staying lean and mean. Because Miso, which is right around the corner.
Oh man, I'm going to be there way too often.
Their fried chicken.
Can we just one more time? So it's two separate words.
Miso.
Hey,
He is doing his best.
It's important that you get the name right with that giant tongue flopping around. Miso. It's like a person.
Yeah.
That was a lot of free mentions there. Fried chicken. Go.
Yeah.
You know
or the prawn toast.
I had last night was the bok fries over at Pomona.
So good.
Oh, dude.
So good. I feel like they need the McDonald's sign. Like they have however many bok fries served. I know they did that initial campaign, but the number's still growing.
Oh, they've done over 20,000 of those in the few years they've been open. By the way,
that was plenty of time to think about who do you put in the seat.
I have to recommend my pastors, Ben Garati and John Crable.
Really?
Okay. I really think that they're just really fascinating, interesting people. I think Montrose needs Christ.
Okay.
And I think that those are great guys to share the gospel.
I would absolutely love for that to happen. It would be interesting. I'm not gonna speak for Rob, but I'm not a churchgoer. I am, but I'm open to those dialogues and those conversations.
Oh man, let's talk.
And so, I would love that. So what church do you go to?
We go to Calvary Chapel.
Okay. Yeah. Well, let them know. Let them know they should come sit down.
I'll text them when I'm done.
We should have the conversation.
Yeah.
I would love
for
to.
having me, guys. I really do appreciate the time.
Yeah.
Dennis needs to be saved. That's for sure.
We all need to be saved.
I mean, that goes without saying. But thank you.
Yeah.
We appreciate having you on the show. Hopefully, we'll have you back. Maybe we need to do a health hour or something like that.
I would love to sit down and talk with you guys about that. I think that there's some really interesting things that we could dive into.
Yeah.
Okay.
We'll come back when you've been open for a few months and we'll check in with you and see how it's going and all that good stuff.
That sounds great. And guys, come down to the clinic anytime.
Absolutely. Yeah. Thank you. All right, Andrew, great to meet you. Thanks. All right, everybody, it's been another episode of WKRP. We'll talk to you soon.